The fluorescent lights of the St. Jude's emergency department hummed a monotonous, soul-crushing drone. It was the sound of 3 a.m., the sound of stale coffee and quiet desperation. For Nurse Clara Bennett, it was just the soundtrack of another Tuesday night shift. At 47, with more gray than brown in her tightly wound bun and a web of fine lines around her eyes, she was a fixture of the graveyard shift, as unassuming as the beige linoleum floors. She moved with a quiet efficiency that most mistook for slowness, her limp, a subtle hitch in her left leg, only adding to the perception of her as a woman past her prime, a relic in a world of youthful, energetic medical professionals. Her hands, when she wasn't actively using them, carried a fine, almost imperceptible tremor. The younger staff whispered it was early-onset Parkinson's. Others, more cruelly, said it was nerves. They saw a timid, slightly broken older woman who spoke in whispers and apologized for taking up space. Dr. Preston Vance, the attending physician tonight, saw a liability. Bennett, his voice sharp and arrogant, cut through the ER's low din. Did you or did you not just hang a 500 cubic centimeter bag of saline for the patient in Bay 3? Clara was restocking a suture tray, her movements precise despite the tremor. She turned slowly. Yes, doctor. His pressure was dropping, 85/50. I started a bolus per protocol while waiting for you to be free. Vance strode over, his expensive running shoes squeaking on the polished floor. He was a decade younger than Clara, with a jawline that belonged on a magazine cover and an ego that required its own zip code. He snatched the chart from its slot. Per protocol, he scoffed, loud enough for the gaggle of residents and interns to hear. The Vance protocol is that you wait for my order. You are a nurse, Bennett, a task-doer. You don't make diagnostic decisions. Do you have an MD from Johns Hopkins I'm unaware of? A few of the younger nurses snickered. Jessica, Vance's star resident, smirked openly. She probably got her degree from a mail-order catalog in the 70s, doctor. The laughter stung, but Clara's face remained a placid mask. She simply looked at Vance, her gaze steady. His pressure was critical. I made a judgment call to stabilize him. A judgment call, Vance repeated, tasting the words with derision. From now on, your only judgment call will be deciding between paper or plastic for a patient's belongings. Know your place. He slapped the chart back into its holder and swept away, his disciples trailing in his wake. Clara turned back to her suture tray, her hands trembling a little more now. The tremor wasn't from fear or shame. It was from the effort of holding back, of keeping the wolf inside the cage. Sarah Jenkins, a nursing student with kind eyes, quietly appeared at her side. That was unfair, Clara, she whispered, handing her a fresh pair of gloves. You did the right thing. Clara offered a small, tired smile. Just do the work, Sarah. That's all that matters. An hour later, the world outside exploded. The piercing wail of multiple sirens converged on the hospital, a harbinger of chaos. A dispatcher's voice crackled over the comm system. Multi-vehicle pileup on the interstate. Multiple criticals. ETA 2 minutes. The ER erupted. Vance, for all his arrogance, was a competent trauma doctor. He stood in the center of the room, barking orders, a conductor orchestrating a symphony of catastrophe. Trauma 1 and 2, get them ready. I want blood carts. I want X-ray on standby. Jessica, you're with me. Bennett, you handle triage at the door. Try not to misdiagnose anyone with your ancient voodoo medicine. The automatic doors hissed open, and the first wave of paramedics burst in. Blood, sirens, and shouting filled the air. Clara stood at the entrance, her quiet demeanor gone, replaced by an unnerving calm. Her eyes, which usually seemed tired and distant, were now sharp, analytical, scanning each patient with an intensity that went unnoticed in the chaos. She moved with a purpose that belied her limp. A quick tag here, a sharp directive there. This one's a GCS of 5, straight to trauma 1. This one has paradoxical chest movement, likely a flail chest. Get him to 2. This one's stable for now. Put him in Bay 4. Vance, passing by, overheard her. Flail chest? Bennett, you can't possibly know that without an X-ray. Tag him green and move on. We have actual criticals to deal with. Doctor, look at his breathing, Clara stated, her voice still quiet but firm. The segment is retracting on inspiration. It's a clinical diagnosis. He'll arrest if we wait. Are you questioning my authority again? Vance snarled, his face inches from hers. Tag him green, or I will have your license. You are a dinosaur, Bennett. Your way of doing things is extinct. Clara held his gaze for a fraction of a second too long. A flicker of something cold and hard passed through her eyes. But she complied, placing a green tag on the man and directing the porters to a less critical bay. She knew the man would decompensate in 10 minutes. She also knew that in 10 minutes she would be there to save him, long after Vance had forgotten his existence. It was amidst this bedlam that the last ambulance arrived. The paramedics struggled, not with a stretcher, but with a man. He was a giant, easily 7 feet tall, with a physique that seemed carved from granite. His head was bleeding from a deep laceration, and his eyes were wild with a drug-fueled paranoia. "John Doe!" the paramedic yelled over the noise. "Single driver, rolled his truck. We think he's on PCP. Took 6 of us to get him restrained." They muscled him into the largest trauma bay, strapping his limbs to the bed with heavy leather restraints. Greg, the hospital's portly and perpetually bored security guard, stood by the door, watching with mild interest before returning his attention to his phone. Doctor Vance, ever the showman, swaggered into the room. "All right, let's see what we have here." He shone a penlight into the giant's eyes. In response, the man roared, a primal sound of pure rage, and strained against the restraints. The leather creaked ominously. "Give him 10 of Haldol and 2 of Ativan," Vance ordered, "and someone get security to actually pay attention." As a nurse injected the sedatives, the giant's eyes locked onto Clara, who was quietly preparing an IV line in the corner. He stopped roaring. A strange, focused calm fell over him. He watched her every move. Clara felt the shift. It was a look she knew all too well, the look of a predator identifying a target. She subtly shifted her weight, balancing more evenly despite her bad leg. The sedatives seemed to have no effect. The giant's breathing remained heavy, ragged. Suddenly, with a sound of tearing leather and snapping metal, his right arm came free. He moved with terrifying speed. The first thing he swiped was a vital signs monitor, sending it crashing against the wall in a shower of sparks and plastic. Staff screamed and scrambled back. Greg, the security guard, fumbled for his radio, his face a mask of pure panic. Code Silver, Trauma Bay 5, he squeaked into the radio. Before anyone could react, the giant lunged for the closest person, Jessica, the resident. He wrapped a massive arm around her neck, lifting her off the ground as she choked and clawed at his arm. He held her in front of him, a human shield. The ER fell into a stunned, horrified silence. Dr. Vance stood frozen, his face ashen. "Let her go," he yelled, his voice cracking. "Let her go right now. Security, do something." But Greg was already backing away, his hands raised in surrender. The giant ignored Vance, his wild eyes still fixed on the quiet older nurse in the corner. He started to back towards the exit, dragging the gagging resident with him. It was then that Clara moved. She didn't run. She flowed. Her limp was gone, replaced by a fluid, economical gait. She didn't approach him directly, but moved laterally, placing herself between the giant and his path to the ambulance bay doors. Her hands, which had trembled all night, were now perfectly still. "Bennett, what are you doing?" Vance shrieked. "Get out of the way. You're useless. You'll get yourself killed." Clara didn't even glance at him. Her entire being was focused on the man and his hostage. The whisper was gone from her voice. When she spoke, the sound was low, calm, and resonant with an authority that silenced the entire room. "Let her go." The giant hesitated, surprised by the command in her tone. He tightened his grip on Jessica, whose face was turning a dusky purple. He growled, a low, guttural threat. "Get out of my way, old woman." "This is your only warning," Clara said, her voice dropping even lower. "Release the doctor, now!" For an answer, the giant threw Jessica's side and lunged at Clara. He was a mountain of rage and muscle, covering the 10 feet between them in a single massive step. A collective gasp filled the ER. Vance squeezed his eyes shut, but the impact never came. What happened next was a blur, a sequence of events so fast and precise it seemed to defy physics. As the giant's ham-sized fist swung towards her head, Clara didn't retreat. She moved into the attack. Her left hand shot up, not to block, but to parry, deflecting the massive arm just enough for it to whistle past her ear. In the same fluid motion, her body pivoted. She was now inside his guard, too close for him to use his size and reach. Her right hand, no longer trembling, moved with the speed of a striking snake. 1. Her fingers, rigid as steel, jabbed into the nerve cluster below his ear, at the side of his neck. The giant's head snapped back with a grunt of pain and surprise. 2. Before he could recover, her hand flowed upwards, the heel of her palm striking a precise pressure point just under his jawline. His eyes rolled back in their sockets. 3. As his body began to slump, her left leg, the one with the limp, snapped out. Her foot didn't connect with force but with surgical accuracy, striking the perineal nerve on the outside of his knee. His legs buckled instantly. The 7-foot, 300-pound man collapsed like a marionette with its strings cut. He hit the linoleum floor with a heavy final thud, unconscious before he even landed. The entire sequence took less than 3 seconds. The emergency room was utterly, profoundly silent. The only sound was the frantic beeping of a distant monitor. Jessica lay on the floor, gasping for air. "Doctor," Vance stared, his mouth hanging open, his face a cocktail of disbelief and terror. Greg, the security guard, looked as if he'd seen a ghost. Clara stood over the unconscious giant, her breathing even, her stance perfectly balanced. She looked down at him with a dispassionate clinical gaze, as if assessing a problem that had now been solved. Then, she nudged him with the toe of her shoe, checking his status before turning back to the room. "Someone put him back in restraints," she said, her voice returning to its normal, quiet register. "And check on Dr. Martin." The spell was broken, just as another wave of chaos rolled in. A new stretcher burst through the doors, pushed by frantic paramedics. On it lay a man in his late 60s, his chest impaled by a jagged piece of rebar. He wore the remnants of a military dress uniform. He was coding. "This is General Marcus Thorne," a paramedic shouted. "He was in the limo. Massive thoracic trauma went into VFib 2 minutes ago." Vance, jolted from his stupor, rushed over. "Paddles! Get me the paddles! Charge to 200! "No." The word from Clara was not a suggestion. It was a command. It cracked through the air like a rifle shot. Everyone, including Vance, froze and looked at her. She was at the gurney in 3 strides, her limp forgotten. Her eyes scanned the general's body, the monitor, the injury, processing 1,000 points of data in a second. "Paddles will kill him," she said, her voice now emanating a raw power that no one had ever heard from her. "The rebar is tamponating the pericardium. Look at his neck veins, they're bulging. Trachea is deviated. He has a tension pneumothorax on the right side. Compressions will drive the rebar through his aorta. Stop compressions." Vance stared blankly. "What? Who do you think you are?" "I am the person saving your patient," Clara snapped back. She pointed a finger at Sarah, the student. "Get me a 14-gauge needle and a chest tube tray now. You," she pointed at another nurse, "get me 2 units of O-negative blood and a rapid infuser. Move." They moved. They moved like their lives depended on it, galvanized by her absolute certainty. Clara ripped open the general's shirt. She located the second intercostal space at the mid-clavicular line. Sarah slapped the angiocath into her hand. Without a moment's hesitation, Clara plunged the needle deep into the man's chest. There was a sudden audible hiss of escaping air. On the monitor, the general's blood pressure, which had been plummeting, instantly began to rise. His heart rhythm flickered from ventricular fibrillation back to a weak but steady sinus tachycardia. The entire ER staff stared in awe. She had just performed a flawless life-saving needle decompression under extreme pressure, a procedure that made most ER doctors nervous. As the general's vitals stabilized, his eyelids fluttered. His gaze, hazy at first, drifted around the room before locking onto Clara's face. A flicker of recognition dawned in his eyes. His voice was a bare, ragged whisper. "Valkyrie? God, is that you?" The name hung in the air, alien and powerful. Dr. Vance looked from the general to Clara, his expression crumbling into utter confusion. "Valkyrie? What is he talking about?" Before Clara could answer, the ER doors slammed open again. This time, it wasn't paramedics. It was a team of 6 men in black tactical gear, armed with short-barreled rifles. They moved with the silent, predatory grace of apex predators. Their leader, a man with a scarred face and cold eyes, swept the room, his gaze finally landing on the general and then on Clara. His professional demeanor cracked for a split second, replaced by sheer relief. He immediately snapped to a rigid position of attention. "Ma'am," he barked, his voice echoing in the stunned silence. "Angel 6 is secure. We're clear to evacuate." He then turned his icy gaze on Dr. Vance. "Who's in charge here?" Vance, flustered, puffed out his chest. "I am. I'm the attending physician, and you people can't just—" The tactical leader cut him off, taking a step forward that made the doctor flinch. "You will address this woman as ma'am or colonel. This is Lieutenant Colonel Clara Bennett, United States Army, retired. She was one of the most decorated special operations combat medics of the last 2 decades. She has more confirmed saves and active firefights than you've had patients in your entire pampered career. The general is in her care now. You will give her anything she asks for, or I will personally introduce you to the concept of institutional irrelevance. Do you understand me?" Vance's jaw worked, but no sound came out. He just stared at Clara, at the quiet, limping, middle-aged nurse he had ridiculed and humiliated all night. The tactical leader wasn't finished. He looked around the room, at the stunned faces of the staff. "So, you all know," he said, his voice ringing with pride and fury. "The limp she has is from shrapnel she took in the Korengal Valley after her helicopter went down. She took it while shielding a wounded ranger with her own body. The tremor in her hands is from the 36 hours she spent performing surgery in a blacked-out C-17, saving the lives of 3 critically wounded SEALs during a transatlantic flight. She was awarded the Silver Star for that. She holds 2 Bronze Stars for Valor, a Purple Heart, and the Combat Medic Badge with 2 stars. She is a legend, and you treated her like a janitor." Each word was a hammer blow to Preston Vance's ego. He visibly shrank, his face turning a blotchy, mortified red. Jessica looked at the floor, unable to meet anyone's eyes. Sarah Jenkins, however, was staring at Clara with tears in her eyes, a look of profound, undiluted awe on her face. The tactical team moved with practiced efficiency, prepping the general for transport. Clara directed them, her voice a calm, steady stream of technical commands. "His pressure is stabilizing, but he'll need a full thoracotomy. Let's get a chest tube in before we move him. I want him on a fluid warmer, and let's get another large-bore IV started." The team leader nodded. "Yes, ma'am." As they worked, he leaned in close to her. "It's good to see you, Valkyrie. We heard you'd gone quiet." Clara looked up from her patient, a ghost of a smile touching her lips for the first time all night. "Sometimes the quietest places are where you're needed most, Chief." With the general packaged for transport to the military hospital, the tactical team prepared to leave. The leader paused and turned to face Clara. He and his entire team snapped a crisp, formal salute. In the sterile, fluorescent-lit chaos of the St. Jude's ER, the gesture was surreal, a moment of profound military ritual. Clara Bennett stood straight, her posture perfect, the weariness momentarily gone from her face. She returned the salute with a slight, precise nod. In that moment, she wasn't the quiet, timid nurse anymore. She was Lieutenant Colonel Clara Valkyrie Bennett, a warrior, a healer, a hero who had been hiding in plain sight, waiting for the one moment when the world needed her to be herself again. The hum of the light seemed to fade, replaced by a new sound, the deep, resounding silence of respect.